Hello everyone. So this is the second episode in this continuation of career counseling for orthopedics, and we'll be talking about a very interesting topic, that is orthopedics an end branch or not. So hello everyone, I'm Dr. Tushar Mehta. I'm an orthopedic surgeon, faculty of orthopedics, and today I'll be talking about whether you can call orthopedics as an end branch or not. I see a lot of people asking me the same question, that sir, I don't want to pick up surgery because I think that orthopedics is an end branch, so I should settle down with orthopedics rather than surgery, because in surgery further I have to spend more time in doing MCH. Well, my answer to this is that yes, orthopedics is not an end branch. See, you have to understand that trauma was, is, and will always remain your bread and butter. But when you talk about arthroscopy, arthroplasty, spine, hand, foot and ankle, there are so many things, so many avenues which open up once you finish your post-graduation. The only difference from surgery is that definitely you are not supposed to write a competitive exam for that. You have to train yourself, you have to get fellowships, you have to get observerships, you have to get into certain courses in India and abroad to become a trained subspecialist. There are different places which are famous for different fellowships in scopy, plasty, spine, foot, ankle, hand, vascular. So my point of view here is that don't take orthopedics just thinking that it's a matter of 3 years and after 3 years you're good to go. Of course you're good to go as an orthopedic resident, but then after 3 years of post graduation I will not say you will, but I will say that you should undergo a senior residency of minimum 2 years. To be on a safer side, if it can be a 3 years, that's amazing, but minimum of 2 years of senior residency should be done so as to train yourself with the utmost basic bread and butter of orthopedics, that is trauma. Once you're done with that, so 3 years of post-graduation, minimum 2 years of SRship, after 5 years, then I think it is a good time to venture into a subspecialty and think about it, and then you can pursue it further, whether it is scopy, plasty, spine, oncology, foot and ankle, hand, even pediatric orthopedics. So again, in this video I want to cover this as well, that I get a lot of questions that what are the further subspecialties. See, the one which has always been very famous, which many people have liked always, is obviously, I'm sure most of you must be aware of it, arthroplasty, joint replacement. लोगों को थोड़ा fascination ज़्यादा रहा है. I mean, when I was a student, then at that point of time it was quite in fashion. But what I've seen in the last couple of years, the trend has been changing, and people are now getting a little away from arthroplasty and going towards arthroscopy. And when they're going towards arthroscopy, not only they're doing it diagnostic and therapeutic, they are actually doing it for the fracture reduction. So arthroscopy is something which I think is evolving and will continue to evolve. Apart from that, one area which is often neglected is orthopedic oncology. So I would definitely like to put a mention here as far as orthopedic oncology is concerned, because see, not many people are trained orthopedic oncologists. So we should think about orthopedic oncology. Believe me, it takes time to settle down as an ortho-oncosurgeon, but it is as good as it can be. And if you still have any query, I can connect you to one or two good ortho-oncosurgeons that we have in our circle. Then pediatric orthopedics. Believe me, pediatric orthopedics is one such amazing field where you can excel like anything. But the only hitch that I see most of the people is having is that like they want to practice, they want to establish themselves as pediatric orthopedic surgeons. So because of that, they stop doing trauma. They stop doing scopy. They know everything, but they stop doing that, and they start referring that to a general orthopedic surgeon, but in return they don't get the pediatric deformities to operate. But that's again a part of the that's a part of the process, and it's something really amazing. So ortho-oncology, pediatric orthopedics, I see that quite evolving. Arthroscopy will always be evergreen. Apart from that, spine is a very gray zone. It is overlapped by the neurosurgeons. And as far as the hand, shoulder, leg, ankle and foot is concerned, even a 6 month to 1 year of training into these fields is sufficient enough to establish yourself as a subspecialist. So again, coming to the basic question, it's not an end branch. There are multiple subspecialties, and you will feel delighted that once you're done with 3 years of PG plus 2 years of SRship, then you'll be more than happy to venture into one or maybe two of these subspecialties, and you can do wonders if you have the right approach towards a clinical practice, if you are willing to establish into a private practice sort of a setup. But if you're planning to be there in a college, in most of the academic purposes, then things are a little different. What I've given you is a perspective from a private practitioner's aspect. So guys, in this video, in this episode 2, we have spoken about subspecialties. There will be a episode 3 where we'll be talking about MS versus DNB, and episode 4 where we'll be talking about females taking up this branch. Is that still a social taboo, or have we broken it? So we'll see you soon in the remaining episodes. Thank you so much. I wish you all the best. Take care of yourself and everyone around you. I wish you all the best.